Minister of Tourism, International Transport and Maritime Initiatives, Honorable Denise Charles, the Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, Honorable Kent Edwards, media partners, ladies and gentlemen, good morning. Today, we've arrived at another phase of the reopening of our country, and that's the reopening of our borders. Of course, we understand that our fellow Dominicans who are, for one reason or another, stuck abroad have been anxious to get home. As of today, there are legal ways to come into the country. First off this morning, we have with us the Minister for Tourism, International Transport and Maritime Initiatives, Honorable Denise Charles, who will tell us about the pre-arrival procedures.
A pleasant good morning to my colleague, the Honorable Minister of Health, Dr. Irvin McIntyre, the Parliamentary Secretary, Honorable Kent Edwards, the listening public, the media. Dominica reopens its borders on July 15th, following successful restrictions to curtail the spread of the coronavirus pandemic. Minister for Health, Wellness and New Health Investment first made the announcement at the press conference on July 1st, and the Prime Minister confirmed the dates and elaborated further on the intended protocols in subsequent radio and television programs. The reopening of borders will be done in a phased manner, with nationals allowed to return home from July 15th in Phase 1 for travel by air, Douglas, Charles, and Canefield airports. All travelers, including non-nationals, can travel to the Nature Island from August 7th, 2020 as part of Phase 2 of the reopening of borders if all goes well. Health and safety guidelines and protocols have been carefully deliberated and formally announced to keep the probability that new cases of COVID-19 may be recorded once the borders are reopened as low as possible. These protocols are not only for Douglas Charles, but for all ports of entry once opened, and are for both visitors and residents. Following are the protocols to be followed as we reopen our borders. Compulsory requirements. All travelers must submit a health questionnaire online at least 24 hours prior to arrival in Dominica. Visit dominicacovid19.dominica.gov for further information and to access the health questionnaire. Show the notification of clearance to travel on arrival. Submit a negative PCR test result recorded within 24 to 72 hours prior to arrival. Present both your PCR test results and notification clearance to travel upon arrival at Douglas, Charles, or Canefield Airport. Other protocols. Travelers are required to wear face masks at all times during the arrival process up to and including departure from the airport. Travelers must observe physical distancing guidelines. Travelers must practice good respiratory and personal sanitization. Travelers must follow all instructions of healthcare staff, officials, and security personnel. Departure from Dominica. For persons departing, the following must be observed. Vehicles will only be permitted to enter the air and seaport with the driver and person due to travel. Travelers must wear face masks at all times during the departure process until departure from airport. Travelers must observe physical distancing. Travelers should practice good respiratory and personal sanitization. Follow instructions of healthcare staff, officials, and security personnel. Ports of entry. The ports of entry are obviously a critical aspect and center given the fact that they will be the first point of entry into Dominica. As such, protocols for the ports have been done with a multi-layered approach taking into consideration the visitors, government, private sector agencies, with a focus on the health culture, preventative measures, risk for seamless health screening that can avoid potential direct impacts on the operations of the ports of entry. The measures to be implemented for combating COVID-19 will last as long as required. Protective measures being implemented to combat the spread of COVID-19 at the ports of entry will be simple and practical to avoid undue passenger delays. They include the following, considering that locals must access the ports to pick up visitors as well as to drop off travelers. All personnel entering the ports will be temperature screened upon arrival and departure. Temperature screening will be implemented at entry points at the Douglas Charles Airport, Canefield Airport, and Longhouse Port during the first phase of reopening. Passengers in the vehicle will be limited to the driver only to pick up as well as drop off. Mask wearing will be strictly enforced. On the departures, facilities at the ports of entry for passengers will be restricted to workers, authorized personnel, travelers, and accompanying persons in situations such as persons with disabilities, reduced mobility, or unaccompanied minors. Airlines will be encouraged to introduce electronic boarding passes in advance from home or hotel to reduce the number of person-to-person interaction where possible. DASPA will be undertaking more frequent cleaning of touch areas of the terminal after each flight. Hand washing and other sanitization stations have been installed at all ports of entry. Deep cleaning of the passenger terminal will be undertaken on a regular basis. Strict hygiene guidelines will be enforced for all in keeping with the Ministry of Health protocols. Both Douglas Charles and Canefield will be utilized as ports of entry for air access. I am advised that on July 15th, at least 2 charters will be arriving with nationals and residents. Prior to COVID, Dominica was served by Liat, Winair, Air Antilles, Silver Airways, and Inter-Caribbean Airways, with scheduled service and a number of other airlines like Air Sunshine and Coastal Air with scheduled charter service. We have been in contact with these airlines during the COVID pandemic, and now that we are reopening, we anticipate that they will come back to service Dominica. The timelines will differ for each as there are a number of factors at play. For instance, islands from which they are domiciled are not open to visitors yet, so it makes it difficult for the airlines to operate cost effectively. Demand for services is another critical factor that the airline need to consider. We are looking to establish a schedule for Dominica that allows travelers convenience. This we anticipate will be finalized soon. Silver has established a schedule of traveling on Thursday and Saturday, departing San Juan at 10:50 a.m., arriving in Dominica at 12:35 p.m., departing at 1:05 p.m. to arrive in San Juan at 2:50 p.m. We ask travelers to Dominica to continue to monitor the websites of the airlines for schedules to Dominica and any travel advisories, as well as to monitor the discoverdominica.com website. On August 7th, the ferry terminal is expected to open, and we anticipate service from the ferry companies. The Ministry of Health, Wellness, and New Health Investment, along with DASPA, will implement the protocols for arriving and departing passengers at the port as well. My ministry continues to work with all other ministries and stakeholders, including the DHTA, to implement the protocols to allow travelers to enjoy their stay in Dominica. Protocols for the accommodation sector are finalized and being implemented by the Environmental Health Department and the Quality Assurance Unit of DDA. These protocols have health and safety as their primary focus. Similarly, eating out and enjoying the wholesome cuisine that Dominica has to offer is a key part of the Dominica experience. Protocols for restaurants and food and beverage at hotels have also been put in place. My ministry continues to work with the Ministry of the Environment through the Forestry Division to ensure that the sites and attractions will be ready to offer that unique nature island experience. It is our intention that visitors to Dominica will be able to experience the sites and attractions while adhering to protocols. It is an exciting time for us as we reopen, but one that we must approach with cautious optimism. Our actions and adherence to the protocols and practices that made us one of the safest countries in the world must continue. We must be vigilant in our practice and assertive yet courteous in ensuring that our fellow Dominicans and guests follow the practices as recommended by the Ministry of Health. Thank you.
The Honorable Minister for Tourism, International Transport and Maritime Initiatives, Denise Charles. Of course, as she mentioned, we work very closely with her ministry in this operation, and we thank them for their services thus far. Our next presenter is the Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, and he'll tell you a little bit about what you can expect once you've arrived in Dominica.
Let me first recognize Honorable Dennis Charles, Minister for Tourism, International Transport and Maritime Initiatives, Parliamentary Secretary in the Ministry of Health, Honorable Kent Edwards, and a pleasant good morning to the listening public, those here at home and those listening abroad. We've reached a stage, the much anticipated stage of our response to COVID-19. Today, the 15th of July, when we open our ports to nationals and residents. And the 7th of August, we'll also open our ports to non-nationals, and also the ferry will be allowed to come in. Tentatively, date we've set is the 7th of August. So today, 15th of July, it's nationals and residents. And on 7th of August, we'll be willing to accept, we'll be prepared to accept non-nationals to our shores. It's been anticipated for a while because we've been gradually relaxing the restrictions as regards to the local economy and then as regards to the curfew measures, and now we've reached a stage where we can finally open our borders. It was much anticipated. We put a lot of work into it. All the stakeholders have worked tirelessly to get to the stage where we can eventually be opening our borders. That is the medical personnel, that is doctors, nurses, all the frontline workers have been working on the protocols as to how we open our borders. Also, we have to recognize the Ministry of Tourism, DDA, Dominica Hotel and Tourism Association, the Taxi Association. They've all played a part in coming together so we can present the best protocols possible. We also had the customs, we had the fire and ambulance, we had the immigration, and everyone played a part in preparing these protocols as to how do we open our borders in a safe way, safe for our people here and safe for even the visitors coming as well. There's no blueprint as to how you open a border. is uncharted territory. So we've learned from the mistakes of some of the other countries, and we've also learned from the best practices of some of the other countries. And we've tried to put protocols together that would represent the best way forward in opening our borders. But let me just go through them slowly, one by one. First and foremost, when you get to our shores, whether it's through, well, at the moment, we're going to open through the Douglas Charles and the Kenfield Airport. When you get off the plane, you should be wearing a mask at all times. This is the first protocol that must be observed by all travelers. You must be wearing a mask at all times. Secondly, you get to the automated sanitizing station. It's touchless, it's sensor, and you use to sanitize your hands. Thirdly, you get to the next station where a health assessment is being done, and that includes taking your temperature. At this point, your temperature can either be 99.8 and below or 99.8 and above. If it is 99.8 and below, then you proceed to the next station where we'll do the authentication of your PCR results, as well as the confirmation of your approval notice, because you would have gotten approval from filling out your questionnaire online. So by the time you get in, we know whether you're approved or you're partially approved. So we know exactly what's happening. And thirdly, we check your ID, which would be your travel document, most probably your passport. So at this point, authentication of your PCR result, confirmation of your approval notice, and confirmation of your ID. That most probably be your passport. You move to the next stage. If your temperature, as I said, is below 99.8, your next stage is the primary screening site. At the primary screening site, a rapid test will be done for every traveler. At this site also, issuance of alert cards. These are the cards that gives you the signs and symptoms of COVID. And your temperature is also on this particular card. So when you get to the primary screening site, the rapid test is done, the issuance of alert cards, which gives you the signs and symptoms of COVID, as well as your temperature, which is recorded on that particular card. If your rapid results are negative, then you can proceed to the next station, which is the immigration. And at immigration, all the different measures have been placed as regards to the screens to avoid the close contact and to maintain the physical distancing. And when you're cleared from immigration, then you proceed to customs. At customs, all the other public health and social measures will be adhered to. And when you're finally cleared from customs, you can leave via our taxi association, which has been certified, and they've all been trained to carry our travelers from the airport. So I will repeat again. On getting off the plane, you must have a mask. Secondly, automated sanitizing station. Thirdly, the health assessment, which includes temperature. Fourth, there's the documentation review. The documents being reviewed, your PCR, your approval notice, and your traveling documents. Then you move on to the primary screening site where the rapid test is done. If your rapid test is negative, you move on to immigration, and from immigration to customs, and from customs you can leave the airport with our certified taxi drivers. However, if your temperature happens to be above 99.8, then you proceed to the secondary screening site. And also, there are other reasons why you may have to proceed to the secondary screening site. The other reasons, besides a temperature above 99.8, would be entry with a positive PCR result. Dominicans coming home, even if you're to have a positive PCR result, you may use a charter, and we make allowances and we make arrangements for your entry into Dominica. Besides this, if you enter without a PCR result, yes, you'd proceed to the secondary screening site. If you have an invalid PCR result, you will proceed to the secondary screening site as well. If you're determined to be high risk, for example, if you worked in a hospital where there were COVID cases, regardless of you having a negative PCR, you will still proceed to the secondary screening site. Also, refusal to do a rapid test, you will proceed to the secondary screening site. And if you have a positive rapid test, you will also proceed to the secondary screening site. So there are 7 cases where you will proceed to the secondary screening site and not the primary screening site. This secondary screening site is outside of the terminal, and it is at our Port Health building. So I'll repeat the 7 conditions where you will proceed to the secondary screening site. Temperature of 99.8 and above, entry with a positive PCR result, entry without PCR result, invalid PCR result, or if you come from a high-risk group, that means someone who've worked in a hospital where there were COVID cases, refusal to do a rapid test or a positive rapid test. All these would proceed to the secondary screening site. At the secondary screening site, a PCR test will be done. That means a swab will be taken. And if you have symptoms, then you are transported to a mandatory isolation, which can be done at Portsmouth or at our Dominica China Friendship Hospital. If you are asymptomatic, means you have no symptoms whatsoever, then we put you into mandatory quarantine. Whether it's mandatory quarantine or mandatory isolation, you have to wait until you get your PCR results before you are cleared. The intention is to have those results within 24 hours, which is what we have been doing. But in the event that it takes longer, you will not get out until your PCR results have come in and you have been cleared. Now, if you have been cleared, then you can proceed to home where we have the primary healthcare system. So although your test is negative, we have our surveillance teams, part of the primary healthcare systems, which will be monitoring everyone in the community who pass through, regardless whether you may have had a PCR that is negative. We have the apps for this, and we will be calling these people. We would have had their addresses, their telephone numbers, everything from the pre-arrival questionnaire that was mentioned earlier by the Honorable Charles. Having mentioned all these protocols upon arrival, it is important for us to recognize that we've done everything possible, considering our resources, and but it all boils down to how you and I handle things from here on. It has to be all-inclusive. It has to be a collaborative effect. And everyone must play their part. It's a collective effort. So the things that we've been doing before, all the public health and social measures that we've mentioned time and time again, this is when it becomes even more important. We're opening borders. We must not be naive. We must face the reality that there may, God forbid, but there may be cases coming in, and we must be prepared. We've done everything possible to prepare the system in the event that that may happen, but you, the public, we must play our part. So it comes down to the public health and social measures. It comes down to washing our hands. It comes down to physical distancing. It comes down to respiratory etiquette, how we sneeze, how we cough. It comes down to our activities and our socializing. We have to put these things back into place. We've done it before. We were successful doing it. We have to do it again. This is the only way we can mitigate the risk associated with opening our borders. So the Ministry of Health, the government of Dominica, we are pleading to you, the public. We all must play our part. You adhering to those measures is your contribution and your response to fighting COVID in this beautiful country of ours. So we are pleading with you, please take heed, adhere to the measures, adhere to the guidelines being put forward to you. And if we can do this, yes, we can have a safe reopening of our borders. Now, in terms of departure, which Honorable Charles did mention, we have also put in some measures for departure from Dominica, and they would like everyone to follow them as much as possible. And it doesn't mean that since we are leaving that we're not going to adhere to those measures, because we have to protect our brothers and sisters in the other islands and countries as well. So vehicles will only be permitted to enter the air and sea port with the driver and persons due to travel. And at the entry of all the ports, temperatures will be taken of the travelers as well as the taxi drivers, all persons entering the ports. Travelers must wear a mask at all times. Even if when you're in the departure, you must wear a mask at all times. Travelers must observe physical distancing. Whether you're passing through the immigration, you must observe physical distancing at all times. Travelers should practice good respiratory and personal sanitization while in the airport. All follow all the instructions from healthcare staff and the officials. If we can adhere to all these protocols, and if we can just follow all the guidelines, I think we can have a safe reopening of our borders. As a matter of fact, this morning we had our first flight. We had 6 passengers coming in, and everything went as it was supposed to. It was a very smooth organization this morning. Everyone went as planned, and we are expecting our second flight this afternoon again, and tomorrow the flights will keep coming in. So far, we've done pretty well. We've done good. All our persons who came this morning had PCR tests negative, and all our staff at the airport, and I must thank all the airport staff, whether it's immigration, customs, DASPA, fire and ambulance, the medical personnel. You all did an excellent job, and for this we are proud, and let us continue to do it together. So as I've said before, if we put our minds together and we put all our actions together, we can pull it off. We've been on our way, we've done it before, let's do it again. I thank you.
Thank you to the Honorable Dr. Irvin McIntyre. Before we wrap up, just a few things. Firstly, a reminder of the website. For those of you needing to enter Dominica, you may access the health questionnaire at domcovid19.dominica.gov. That's gov.dm. That's domcovid19.dominica.gov.dm. Remember, that is mandatory if you intend to come into Dominica. Of course, both ministers mentioned those of you leaving the country, but for those who require a PCR test before leaving the country, this is what you'll need to do. We ask that you call 611-3905 to make an appointment. That's 611-3905. You need to get a requisition form from your district medical officer. So that would be the doctor at your health centers in your communities. After that, you'll need to pay for your test, and that will be done at the accounts department at the Dominica China Friendship Hospital. Once you've paid, you can bring your receipt to the primary healthcare services. For those of you who don't know, that is located at the Roseau Health Center. That's primary healthcare services. And that's where your test, your PCR test, will be done. So again, 611-3905, that is the number to call if you would like to make appointments. And then, of course, you get the requisition form from your district medical officer, your doctor in your community. You pay for that test, and the cost of that test is 100 EC dollars or 40 US dollars. You pay for that test at the Dominica China Friendship Hospital. Then you follow that with going to the primary healthcare services. And of course, that's where your test is done. Of course, that is to mitigate your travel. Should you require a PCR test upon arrival in any other country, that facilitates your travel. Ladies and gentlemen, we'd like to remind you that none of these protocols are meant to make your life difficult, are meant to punish you. It's a lot of work for the people involved, as a matter of fact. However, the intention remains to protect ourselves, to protect our country. So we ask everyone to please adhere to these measures. When you get to the airport, try your best not to give the officials a hard time. They're doing their jobs, and their job is to protect you. Again, we thank you as always for your patience. We thank you for listening, and we wish everyone a good day.